Both ehrlichiosis and anaplasmosis are tick-borne illnesses with very few differences. One significant difference is the type of tick that carries the disease. Both diseases are transmitted via the nymphal black-legged tick. However, ehrlichiosis is primarily the result of a tick from the Lone Star tick, where the western black-legged tick is the culprit for anaplasmosis. What makes both illnesses difficult to diagnose is that most people that have either disease do not show symptoms until 1 to 2 weeks after they have been bitten and are rarely aware that they were even bitten by a tick. Additionally, the symptoms are usually mild and can mimic other illnesses: fever, chills, muscle aches, severe headache, gastrointestinal issues. If left untreated, both illnesses can lead to respiratory failure, bleeding problems, organ failure, or death. Further complicating diagnosis is that it typically takes 1 to 2 weeks for test results to come back, confirming diagnosis. That's if the provider is savvy enough to test for either illness. According to the CDC, ehrlichiosis is primarily reported in the southeastern and south central United States, with 4 states accounting for more than half of the reported cases in 2018. Those states are Missouri, Arkansas, New York, and Virginia. Please note that Missouri and Arkansas are states within close proximity to Nebraska and Kansas. For anaplasmosis, the CDC reports that it is more frequently reported in the upper Midwestern and Northeastern United States, with most cases being reported in New England, with the exception of Connecticut, New York, and Wisconsin. Even though none of these states border Nebraska or Kansas, the CDC does report that Kansas has had anaplasmosis infections in 2018. The rate was 1.1 to 8.3 persons per 100,000, and this is a state that borders Nebraska. Given the rarity of both illnesses in Nebraska or Kansas, it would probably not be the area a provider would look towards diagnosis. So that is an issue I could see for both states. What measures can be implemented to prevent these illnesses from being overlooked? This is a really difficult question. At the presentation of symptoms, most providers would look towards the obvious, a viral infection that would clear up in a few days. If the symptoms persist, primary care providers may take a more extensive history, including travel to other states, and if they participated in any activities that could have resulted in a tick bite in the past month. And often, people have a hard time recalling what they've done in the past month. Tick-borne illnesses are very serious and they can result in devastating effects if left untreated. So it's important at the first presentation providers include those questions in their history. This would require more education on these illnesses from the CDC, the American Medical Association, and other respected medical organizations.